Hi, I'm Corinne Capodagli.
And I'm Kody Clements. We are both special education and elementary education majors.
And because we have the same major and it fits so well within our concentration, Kody and I decided to study the integration of bibliotherapy and special education interventions.
The question that we set out to answer pertains to the effectiveness of bibliotherapy being incorporated into the tiers of response to intervention strategy, otherwise known as RTI. Bibliotherapy does have many benefits that we will discuss further throughout this presentation. Our question serves as a springboard to assess the effectiveness of this strategy for elementary age students who have been identified as needing extra help in the educational setting.
The data we collected pertains primarily to the situations in which bibliotherapy is commonly used, as well as the mental and emotional benefits that may result from it. Using data from peer-reviewed research, primarily available through the ProQuest database in the Carroll College Library, we furthered our understanding on the definition of bibliotherapy and its current utilization, and we coupled this with federal and state special education standards to analyze what additional benefits this may offer and how it could be implemented into the K-8 school system.
We will now discuss our findings. According to the Psychological Medicine book published online by Cambridge University, many assume that children do not suffer from anxiety or depression simply because they are too young to worry about such things. However, both parental and societal pressures concerning academics, athletics, and home life can have detrimental impacts on children. Bibliotherapy should be incorporated both in the special education setting concerning the RTI levels, as well as in the general education classroom for all students who have access to. Although reading is already a large part of learning in school, it's not necessarily used for the purpose of bettering students' mental health. It needs to be emphasized that reading can be a fun, beneficial self-help mechanism. Implementing bibliotherapy into schools with the goal of improving mental health is inexpensive, easy to apply, and it comes with no side effects. In order for bibliotherapy to be beneficial, students should be told how it works and why it is being done so they can properly apply the treatment for themselves.
In the article, Bibliotherapy and Anxiety Levels of Fifth Graders, the researchers examined the correlation between utilizing bibliotherapy in the general education classroom and decreased levels of anxiety, as measured by the Beck Anxiety Inventory for the Youth. The researchers divided the students into two groups, Group A and Group B, and compared subsequent levels of stress reduction after a 2-week interval. The research determined that students in Group A, who had received targeted bibliotherapy intervention for 3 one-hour sessions, had lower levels of anxiety than their counterparts in Group B, who had received 3 normal storytime sessions during the 2-week span. This article serves as a good direct link back to our research question, demonstrating how bibliotherapy can be utilized as an intervention strategy, and moreover, how effective it is as a coping mechanism. This would be a good strategy to examine for both our neurotypical students who have been identified as needing more intense targeted support, as well as students who had needs aligned with an emotional disturbance or other health impairment. This would fit within the national standard and IDEA definition of an emotional impairment, which is defined by an inability to build or maintain satisfactory interpersonal relationships with peers and teachers, or a tendency to develop physical symptoms or fears associated with personal or school problems. And we got that definition from the Montana Department of Public Health and Services. Utilizing bibliotherapy might entail reading about specific targeted problems that have already been identified by the IEP team that the student is working towards. For example, if finding alternatives to aggressive or antisocial behavior is a goal identified by the IEP team, then reading a targeted bibliotherapy book on such topics might be helpful. In the book, Bibliotherapy Revisited, Issues in Classroom Management, the author examines the purposes of bibliotherapy and particularly the assets it provides when working with emotionally disturbed youth. A direct quote from the article claims that, by identifying with characters in books, children may come to realize that they are a part of humanity, that they're not alone in their struggles with reality. Moreover, reading increases personal knowledge and invites the readers to consider themselves objectively, unquote. Also from the article, bibliotherapy is currently being used to help children who are experiencing a variety of emotional and developmental difficulties. These difficulties may include controlling aggression, managing stress, and initiating and maintaining social relationships. The book also discusses how stress can lead to maladaptive coping strategies, like acting out in the classroom and at home. A controversial yet important part of the article examines how the use of drugs like Valium are prescribed as a way to dull or mitigate some of the anxiety that leads to increased participation in maladaptive behaviors. The book also notes that this might not be a particularly good coping mechanism for young or adolescent students, as it can actually decrease emotional responsiveness. This means that some medications are actually inhibiting students from reaching success, and bibliotherapy could be utilized as a more natural and effective form of intervention that could be implemented in the K-8 curriculum.
An article from psychologynow.com discusses how many students who are in special education programs suffer from anxiety, depression, and other mental health issues. Along with everyday challenges that all children face and must work through, these students also have to combat the stress that comes with having extra challenges at school. Bibliotherapy has the potential to allow students to gain insight into their personal challenges, promote problem solving and new strategies, and gain perspective as well as empathy. We will now go through the discussion. At this point in the presentation, we've discussed RTI quite a bit. We'll now inform you guys on what that actually is. The response to intervention is an approach to academic intervention used to provide early assistance to children who are underperforming as compared to appropriate grade level standards. This process includes universal screening, early intervention, frequent progress monitoring, all with the purpose of determining if a child has a specific learning disability and is eligible for special education. There are 3 tiers within the response to intervention system, with Tier 1 being the least intensive and Tier 3 being the most intensive. Tier 1 is focused on students who are low risk, as it includes benchmark assessments, screening, and extra support for students in small groups. Tier 2 is focused on students scoring below benchmarks for the core curriculum assessments and includes extra small group work and opportunities for pre-teaching subjects. Tier 3, the most intensive, is targeted at students who are unsuccessful in the core program and are on the borderline of involvement with special education. Within this tier, students receive special one-on-one help.
Kody and I will now look at, based on our research, how bibliotherapy might be incorporated into the tiers of RTI. Critical in understanding bibliotherapy's implementation into RTI is understanding that it's a multifaceted tool, both beneficial in targeted academic as well as behavioral interventions. After reading through a culmination of different peer-reviewed journals and other scholarly articles, Kody and I came to a conclusion of where we would implement RTI strategies based on primary evidence and sources. Because Tier 1 intervention strategies are generally inclusive to about 80% of the student population, this tier might be too general for more targeted support. However, Kody and I might suggest a broad implementation in the general education classroom, incorporating stories with targeted plot lines and themes to help provide emotional support to all of our students. For example, this might take the form of reading to the class about the difficulties of change and how to overcome this at the end of the school year when they might be about to transition into a new grade. For more targeted interventions, we would start to see a shift into Tier 2 and even Tier 3 interventions, because these are the tiers that serve our students with more specific needs. This might entail a broader exploration utilizing the evaluation information to assess what individual needs each student might have. For example, students with a high ACE score or emotional behavioral disturbances might benefit from targeted material in a specific area. For example, emotional disturbances are often rooted in the inability to maintain interpersonal relationships, which Kody and I reviewed earlier. So it might be helpful to choose a book that looks at targeted social cues and how to incite thoughtful and beneficial social interactions. Tier 3 differs from Tier 2, like Kody mentioned, in the sense that it deals with more intensive one-on-one practicum. Bibliotherapy could also be utilized here for students who need that individual aid, as opposed to small group intervention in Tier 2 with peers who have similar strengths and needs.
Due to COVID-19, we did face several limitations to this project. We would have loved to actually get into a classroom and speak with general education and special education teachers, and even work with students and try out bibliotherapy in multiple settings.
Also kind of going off that, a lot of our research is based on other scholarly articles and peer-reviewed journals. If Kody and I were to continue this next year, we would like to kind of collect some of our own data.
This is our QR code. It's a link to our research paper and our abstract.
And here's our works cited, and thank you so much for watching today.
Thank you.